CCGs are responsible for £88 billion per annum. This is 80% of the entire NHS budget. CCGs are formed of groups of GPs charged with buying services for their patients. The rationale is to give decision-making control to clinicians, but in fact their hands are tied and have been tasked with choosing which hospital services to tender out to the lowest bidder and which services to ration. They have become the tool for dismantling hospital services.
The fear is it will be the GP entrepreneur type who will be having all the power and making decisions which aren't really in the patient's interest.
Structures that you need have been dismantled, and it's not in the CCG powers to put those structures back in place again.
That leads us to the next question, which is, well, who will do the commissioning, and that's really an entry point again for the private sector.
Many GPs have interests in private healthcare arrangements and will be referring to their patients to those. So we're going to have the private sector holding all that NHS money, doing the commissioning process and buying the NHS services from, guess who? The private sector, who are going to be increasingly involved in supplying NHS services. So of course it's like having Dracula in charge of the blood bank.
The old NHS, every single person in every single area was covered. What the government's doing with clinical commissioning groups is moving towards pools of people, like insurance pools. And as you all know, with insurance pools, not everybody is covered. So you're going to be into the nightmare of the American marketplace, where people have to look at the small print of their plans to see what's covered, and then they have to take up top-up insurance and all sorts of other co-insurance policies. And indeed, we're beginning to see the opening up of user charges and user fees in areas such as cancer therapy.
A lot of time we're spending away from patients, away from the surgery, attending meetings and business meetings and budgetary meetings.
But for big companies, the big multinationals, of course, that's their business. Their business is tendering for contracts.
As I fear services will decline, the government will be in a position to, number one, say it's no longer their responsibility, and also to point the finger at the GP commissioners.
And that's going to happen faster and faster, so that people who have a stroke, for example, will find that their care is time limited, they're no longer eligible for speech therapy or physiotherapy or all the occupational health services that they once received. Increasingly that's been time limited, but that will now become much more arbitrary and down to the CCG to decide. The CCG and the providers have enormous discretion over who gets care, and that's the bottom line.
GPs have not been empowered to improve services for their patients. They have been told to spend less money on patient care. Contracts are now awarded on lowest price. It is almost as if the GPs have been handed an axe and must decide now where it should fall. Sadly, many are leaving medical practice in the UK, creating a predictable workforce crisis. Family doctors are now being so deliberately destabilised by this removal of funding that it already threatens over 100 medical practices in this country. This is just the start.
Because the doctors are in charge of the budget, or the GPs are in charge of the budget, and they do the rationing, they are going to have people standing in their surgery actually being quite violent. I mean, have GPs thought about that? Because that is what I can imagine could happen. You get somebody who is maybe not very educated, doesn't understand, and keeps pressing this doctor, and the doctor can't do anything.